Okay, let's get started. My name is Yuki. I'm a medical student in Japan. In this video, we would like to talk about the outside of Japan from the point of view of medicine. And then here today, we are inviting an incredibly handsome guy, Leonardo. Thank you for joining us today.
Yeah, no problem.
But Keiko, could you do a bit of self-introduction, please?
Yeah, so I'm a sixth-year student in the University of Verona in Italy, so in the northern part of Italy. And I've been to Hokkaido University to do an exchange program for around 3 months.
Perfect. So, since he's from Italy, we will discuss what it's like to be a medical student or doctor in Italy. We will also talk about his experiences in Japan as an exchange medical student. So let's get started with about yourself, Leonardo. Would you talk about your general medical college life, please?
Yeah, so like the university in Italy is a bit different. It's still 6 years in medicine, but it's normally it's theory based. So you normally do theory throughout all of the 6 years. You don't do so much training. The training is shortened to a short period of time, and the actual training you do at the end of everything you studied is only 3 months. So it's those 3 months plus every time you do a subject, you need to do maybe a week or so in each department. But it's not so hard. The training part, the hard part in Italian university is the exam part. The exam part is everything for the students, and you don't really need to go to the lessons all that much. You need to go to training, but you don't need to go to the lessons. And the exam part is mostly oral exams, and they are the hardest part you have in the university. Also, the university does not have clubs. So the university is a place in which everything you do is just go there to study, essentially. If you want to go to, do other activities, you can do that outside. You can meet friends outside, but in the university, normally there's just like libraries and the place where you do lessons. So yeah, in university life is not as fun, but you still have a lot of things to do. You have freedom. You have, I think, more freedom because you're free to choose your times a bit easier. Training normally is only in the morning, aside from those 3 months you do at the end. But yeah, this is the general university life. You have an exam at the end, but it's not that hard. And then you will have the most difficult part, which is actually the specializing test exam. That is though after university, and you can take it more than once, so it's no problem. Like you need to do really well on that test, but you can do that again and again. So I guess it's possible to, for everybody it's possible to pass, though not at the first time.
I see. It sounds there are a lot of differences between Italy and Japan. That's curious. Okay, so let's move on to the next topic about Italian doctors. I know this will depend on what specialty they want in the end. However, what kind of career pathway do baby doctors follow in general after graduation?
Yeah, so right after graduation, normally you have a period in which you need to study for the specializing test exam. That is the most difficult exam for us students of medicine. And during that period, you can actually work sometimes. So you can do some easy jobs. For example, you can work as some kind of general practitioner, but during the times in which normal general practitioner don't work. So normally at night or during the weekend. So that is something that you can do. And you earn quite a lot of money compared to what you do on specialty. So the thing is that during specialty is normally between 4 and 5 years. It depends on which specialty you choose. before, like during the specialty, you will earn not that much. You will earn around, so it should be 1,600 euros. But in the end, with taxes, you get to 1,400 euros, which is around like 18万円. So it's not much. And then before that, that's why during the specialization, before the specialization, a lot of people try to get a bit more money to then have a better life during specialization. And normally you work as I said, during the nights, and during those periods you can actually get a pretty good earning. I think it should be around 60万円 or 50万円. It depends really on how much you work and how much you want to work, because it's during the night. It's like you do turns that are pretty long. You do 12 hours turn. So it depends on how many nights you work, but generally it's around that if you work for, let's say, at least 15 nights. So you have that, and obviously after specialty, you will finish specialty and you will actually need to search for a job. So you need to you need to think about where you can work with that specialty, because sometimes you will need to transfer cities. Obviously, you will need to go where you're the most needed. So sometimes, for example, some surgery department, you cannot go really near where you live. You need to go a bit further, in maybe outside the city centers, and you do a few years there. That can be even longer than just a few years. You can actually just stop there and continue to live in that city for the rest of your life. So yeah, that's the main thing you do as your career path. As I said, the main thing is how much you score on the specializing exam. The specializing exam is not just pass or not pass. It's depending on your score. You can decide in which university to go and in which department you go, and you put all the choices on a list. And if the first one is full, then you go to the second, then you go to the third. So it's the actual exam. It's the most important exam, the exam in which your score matters the most, and you cannot actually just choose a specialty because of that, because sometimes some specialties are really hard to enter and you need to be in the top 10%. So sometimes you will need to try to get at least maybe top 20% or top 30% or top 50%, and like try to accept whatever you can there. So this, the main thing is about work, and then when you exit, when you are a specialized doctor, you will earn around 50万円 every month, more or less.
Just out of my curiosity, among many branches of medicine, what specialty is the most popular in Italy?
So the most popular is the one that you can easily do a private part. So normally there's like ophthalmology, dermatology, and then you have plastic surgery, and that is the most popular surgery. Then you may have some specialties instead that you do a bit less of private, but they are still interesting. And you need to consider that in Italy there's like 50% of the doctors are female, 50% are male. So some specialties are more popular between females, some specialties are more popular between males. One of the specialties that is popular here between females is gynecology. So it's actually hard to enter gynecology here, for example, and which I found it different in Japan. Japan was not many people chose gynecology. Not so popular. Here is actually
not popular specialty. Yeah.
It's pretty hard to enter actually here in Italy. And instead, the easiest ones are normally the surgery and the emergency, because emergency, there's a lack of emergency doctor, and so not many people want to actually go there because you have hard times. You normally work during the nights too. You have turns. You work during the weekend. They can call you anytime. So that is why most of the people don't really, it's not like most of the people, it's that there's so much need of them, and the amount of people that want to go there is not as many as the one that are needed. So normally it's pretty easy to enter if you don't want to enter emergency, for example. It's pretty hard instead to enter dermatology, or it's hard to enter ophthalmology, plastic surgery, as I said before.
Okay, I understand. Thank you. So I'd next like to ask about your experiences of studying in Japan. So at the time, did you find anything interesting or unique?
Yeah, so what I think is like there's not one thing that is different and you can differentiate everything. There are so many small things that you notice while you're actually practicing and while you're meeting the other people. So most of the differences are between the relationship between people. So relationship with the patients, relationship with colleagues, relationship with their students, between the students too. Everything is kind of different in that aspect. That has to do both with the Japanese society and also how the system is structured. The Japanese system is a private system with help from the state, from the country. Instead, for Italian system is mostly a public system with some private part in it that has mainly to do with general checkups you need to do. It's not when you have a serious illness. When you have a serious illness, you would always prefer to go to a public hospital. Aside from that, you have obviously some differences that you can notice is, for example, the working life of doctors. So the working life of doctors, normally here, for example, you have a bit easier timetables. You go home a bit earlier. It's still hard. It depends on the specialty, obviously. Surgeons still go home pretty late, but for the other doctors, most of the time they go home in the afternoon, at least. And you have also around 30 days of holidays, so every year. And you normally use all of them. It's not like you leave them out. Even if you don't need them, you still use them. In Italy, you always use your holiday days. It's considered pretty strange not to use them. And aside from that, there's like some small differences. So for example, the bed number differences. So in Japan, you do have room numbers and bed numbers, but in Italy, you actually use them to refer to the patients when the patients are not there, obviously. So doctors, but everybody else, for example, as students, refer to the patient more with the name. We don't know the name actually most of the time. We know just the room number and the number of their bed, and we know where it is. So we remember the faces, we remember the case, but we don't care about so much about the name, especially because I think in Italian language, you never refer to a person directly with their name. So if you're talking directly to a person, you never say their name. So you just need to say you. And that makes it that a lot of the conversation you have, you actually don't know the name of the patient or the name of the person that is in front of you. And sometimes also the name of the patient when you are talking to the patients. But it's something that I noticed that is pretty different in Japan. You actually don't like what I never noticed the bed number, and most of the people when you're not sure on what is the name of the patient, you need to describe the case. You need to describe maybe where it is. You need to try to find other ways to explain which patient we are talking about, and sometimes it got pretty confusing. I'm not sure exactly what system is the best, because it's true here sometimes you tend to not learn as much maybe about the patient, about their personal life more than their actual illness. Obviously you know everything about their illness, but it's a bit easier maybe for doctors, but a bit more impersonal, that is. But I'm not sure which one is a better method. You have both methods are possible, I think. The small differences are so many to count, like really different.
So those differences also are due to a bit of like cultural differences. I got it. It's interesting. This is gonna be the last question. So, if a Japanese doctor feels like working in Italy instead of Japan, what should they do?
Yeah, so obviously I had to look it up for this one.
Thank you.
So what I found out was that there are actually 3 things you need to do. Essentially, the first one is the validification of your degree. Whatever degree it is, and it's not only medicine. If you want to work in Italy, most of the time you need to validify that. You need to make it work in Italy too. If you're a EU citizen, then it's really easy because they recognize the degree of each country, so everybody is already recognized more or less. They just need to ask. And instead, if you are outside, you will need to ask the Ministry of University, which changes every year, or every government, it's better say. So sometimes it's with education, sometimes it's with research, but you still need to go to the one of university, and you ask for the recognition of your and validification of your degree, and they can or recognize it as valid directly without any further things you need to do, or you can have to do some exams. I'm not especially sure on how it is on medicine, if they accept everything, medicine, especially with Japan, or if you need to do some exams, maybe law, maybe something like that. But if you need to do some exams, essentially you need to just ask a university in Italy and do that exam. In Italian, obviously. Oh, well, actually, that is possible, I think, to do also not in Italian. But then for the second part, you need to, to become an actual working doctor, you need to have a visa, and you ask, there's something called Albi here in Italy, which is the organization's kind of doctors, and they are the one that give you the ability to become a doctor, essentially. Normally, I don't think there is any test of any kind, but if you are not Italian, obviously, you need to do an Italian test. So the third part is the Italian test. The Italian test is organized by them, so that means that it's not a general Italian test. The Italian test will be on medicine, so it will be medical Italian test. There's nothing really 100% sure. I'm not 100% sure if there's anything like how the test is done. I'm not sure how it is conducted. I think it depends on where you ask, for which albo you ask, because every city has its own albo, which is its own group of doctors, essentially. Organization, it's better say, of doctors. And once you enter, you can do whatever you want with you can work in Italy however you want. You are not just a normal doctor. So I think even specialty are kind of like you can accept them through them directly, but it doesn't change much because you still can prescribe almost whatever drugs you want, even if you're not a specialized doctor in that field. So yeah, that's the main things you need to do. Essentially, the main 2 parts are your validification of your degree, and then ask Albo, and they will tell you what else to do, and there will be an Italian test.
Right. So I got it. Those 3 things are requirement, and then I also think that's a bit different from USA style, because they asks doctors to complete USMLE stuff, medical tests. But from your talk, Italian, when it comes to Italy, things are not functioning in this kind of way, right?
Yeah, that's probably because up until last year, there was a test to become a doctor, but since last year, there is no test anymore to become a doctor. After you have a degree in Italy, you are already recognized as a doctor. So I'm not sure if you need to do a test, but the test that was previously, it was a really easy test. So even if there is a test, it's probably going to be the same test which is going to be pretty.
It should be more fun, right? Okay, that's very interesting. Okay, actually, that's it today. First and foremost, huge thanks for coming today, Leonardo. What you described was very interesting and surely it gave us a new insight which we had not been aware of. And I also personally hope I can study abroad in Italy one day. But even though it is less likely to happen very soon because we are in the middle of the COVID-19 pandemic right now. But hopefully.
Yeah. So if I have to say something, just ask your university, because a lot of the university in Japan have connection with other university in Italy. So if you want to work in Italy or if you want to do an exchange program, even a short, ask your university. Hokkaido University has one.
Oh, that's really handy.
I'm sure that a lot of other university do have them. Just contact the university or the place you work, and normally there is already somebody that or went to Italy or went to, if you want to go just to Europe, it's pretty, I think they will have connection with Europe 100%. Even if you don't have connection, just try to write emails. You're probably going to get accepted.
So not direct contact. Anyway, again, huge thanks for your wonderful talk. That was very fun.
No problem. It was pretty fun for me too.
Yeah, I'm really looking forward to talking to you like this, another session again. So anyway, that's it today. Have a good day. So bye now. Ciao.
Ciao.